what is coordinated entry? We also refer to it as CE, so you'll hear me say coordinated entry or CE a lot. It's the same. So CE is the starting point to accessing the coordinated entry system services. It is based on HUD mandated categories for those that are homeless and how they access those services. And the process that we use is identification, assessment, prioritization, and then referral. This process is also used for the emergency shelter piece, but it is handled a little bit different, and I will go into more detail in that. All right, so the categories of homelessness. Again, this is based on the HUD categories. So category 1 is literally homeless. So somebody who is in an emergency shelter on the street, staying somewhere that is not meant for them to be sleeping. And then category 2 would be somebody who is doubled up, facing eviction, and must leave within that 14 days. It also includes those that might be self-pay at a motel. Um, we kind of have a 1.5 area, so you kind of see some that might be outside sometimes and some that might be doubled up. It's not really a category, but you will hear us reference it sometimes because they are interchangeable, and it really truly depends on where they are the night prior of when they meet with us. And of course, it can change obviously by following up. Category 3 is youth, so anyone up to age 24. And we typically just actually would refer those individuals to Pathfinders or Walker's Point, but we will serve those that are 18 to 24. And then category 4 would be anybody who is fleeing violence or trafficking. Again, not necessarily handled through CE, but it is because we do all the prioritization. So I'll get into that a little bit more as well. All right, so how can somebody access coordinated entry? They can call 211 24 hours a day. My team typically works anywhere between 8 and 5, so it depends on the person's position and their hours. So if they are calling outside of those hours, they would have to wait for a call back. They can also visit an in-reach location. We currently are at Repairs of the Breach, and that is Mondays and Tuesdays. Tuesdays is changing, so it is best that they do call 211 to get that in reach referral, because it does change right now with warming going on. But these are typically our hours is Monday 9 to 11. We do have a cap on that because our mobile screener can only get through so many people in a certain amount of time. And then also Tuesdays from 8:30 a.m. until 1:15 p.m. Also a cap on that. We will be, like I said, interchanging that and trying to pivot to help assist with that warming space and getting some of those that are in warming currently into emergency shelter as well. So we're trying to assist in that area. St. Ben's is for families, single men and single women. And we have them currently there on Thursdays, sometimes again on Mondays, but again, we're trying to really assist in that warming space. So Thursdays, 11:30 to 3 with a cap at 15. Again, it's first come, first serve. So if you are referring a client there and you're not having them call 211 first to verify the hours, please make sure that you let them know to be there early enough. These spots fill up so fast. So even though, we're at, let's say St. Ben's at 11:30, they start letting folks in at 11 for some of their other services, and they start that list then. So if that list is filled up by 12:15, they can't take anybody else. And then Impact Connect for those that participate in that. All right, so let's see. The coordinated entry assessments. So it gets a little tricky because we have the different categories. And like I said, it really depends on where the person was sleeping the night prior. So if we have somebody who is category 1 sleeping outside, and they contact 211, they get referred over to us. Our intake specialist will actually complete the enrollment for it, or for the client, the intake piece. So they'll complete the enrollment, the SIVA, which is a vulnerability assessment that we use, and then they will add that client to the housing queue. Once this is all completed, that client is then actually automatically placed on our prioritization list, which I will get more into that in one of the next couple of slides. We also connect that client with a referral over to the overnight street outreach team, so that way we can work on getting that homeless verification completed. During warming, we have the ability to refer them to the warming locations, and that will end then at the end of March. So it will go back to simply the referrals for the overnight outreach team. If they are category 2, that client, again, depending on their situation, and when they actually get in touch with us, it can be really kind of a tricky space, because when we're talking eviction can mean many things, whether it's that first 5-day notice, or they've been through the court process and they have a day or two before, the sheriff is coming and removing them. So because of that, it really depends on where they're going to fall in that assessment that we are using, but they would complete for the intake, they would complete the enrollment with the prevention assessment in hopes that we can prevent that. Again, if they're towards that end, it makes it really harder. So if you have clients that may be coming in and they're in that prevention space still, the sooner that we can get them those services to prevent that homelessness, the better. Just because once you start to get towards that end of time where the sheriff's going to be there a day or two, it makes it much harder for us to be able to prevent that. Again, we'll kind of get into what the next process is after that in the next couple of slides. And then category 3, I also had stated that we typically refer to Pathfinders or Walker's Point. If they're over 18, we can complete the assessments. We can refer them to some of the shelters, but we do try to have them start with Pathfinders or Walker's Point. And then category 4, again, this is another tricky one. So because of the nature of this category and kind of their situations that they're encountering, there's a lot of confidentiality and privacy. So we actually have the agencies that are working with them and have access to Clarity enrolling all of their own clients. And then I actually only enroll those that are like agencies that don't have access because they're not allowed to due to funding. So at that time, then we would complete these enrollments for them. We do work with them so that we are making sure that we're keeping everything where it needs to be as far as privacy and such goes. We do have some clients that are in this category 4 space that do present to our InReach sites, and that's totally fine. We are able to complete these assessments with them, but we would also then at that point do our best to try to help them find a DV space as far as shelter. Those spaces are, they have a lot more resources for clients who might be dealing with some trauma, whereas a lot of the emergency shelter spaces don't have a lot of the resources that the DV spaces do. All right, so the prioritization. So a lot of folks will refer to a list that we use, and it is a list because it's how we run it, but it's designed so that way every time an assessment is completed, that list is always changing because it's based on the client's vulnerability. So one week we could have somebody who's number 3, and then there's another week of assessments that are done and more people who are more vulnerable. It could potentially knock that person down on the list. So it really depends on the staffing, but we have PSH, which is the permanent supportive housing, and I'll get into a little bit more detail of these as well. But the Safe Haven, youth, category 4 families and veterans. And again, all of these are based on set criteria using these assessments that are completed during intake. And then we use those to make the referrals to those community programs. Excuse me. So emergency shelter. This is done a little bit differently. We actually hold a live shelter call Monday through Friday from 10 a.m. to 11 a.m. So anybody who has encountered or verified a client outside, and this includes some of the hospital systems, if we have clients that are homeless, but they're currently at a hospital. We do have some healthcare staff that also jumps on. We also have a health system liaison. The position is currently vacant, but in that position, they actually do go on and advocate for those clients as well. So basically, it's a space for everybody to come together. We have a senior housing facilitator who he listens to all of the advocates who are on the call, listens to their stories for each client. And then at the end of the call, it's kind of a collaborative effort of being able to identify who is the most vulnerable. And then he has the final say of being able to prioritize who should have those spaces. Again, this is based on space. So there are days sometimes where there are no spaces available. There's no call. There are days where he might have eight spaces. There might be days where there's 5 female spaces and 1 male space. So it really just depends. But it is a very unique call. And it's really been working, and we kind of have a really good process and flow for it. So, all right. So the referrals. So the permanent supportive housing. For a client that is eligible for this, we have to be able to prove that they have 12 months of documented chronicity and then also a disability. And then once they come up to the top of that list with the chronicity, then we are able to prioritize them for different housing vouchers. These are offered from various different community agencies that we work with. And then the safe haven, this is actually also set up very similar to the emergency shelter call, except we run the list and we have a set amount of people that are on this call that are all the professionals working in this space. And then those that have clients that have come up on the list, we actually invite them each week. So it is by invite only. And basically they come on, they go through and kind of tell their client story. And then our senior housing facilitator is able to prioritize for that space. It's not very often that there's a lot of spaces. It's again, based on availability. And so it's just basically kind of what's available at the moment. We do run it each week. Typically we have like 1 to 2 openings each week, but it just truly depends. And then youth, again, we run a list. We prioritize based on who comes at the top of the list, because we don't have, there's some things that are kind of in the works, but currently because everything doesn't go through CE for youth, we are just simply running the list and then prioritizing. So we are really truly depending on those other partnering agencies to be assessing these youth and then getting them on the list. And then category 4 it's similar to the youth, just because it's a totally different separate space again. Those housing vouchers are also through partnering agencies. This space also has a West Haven transitional housing. So if a client may be eligible or on the list even, or even if we have somebody like an outreach worker who sees somebody overnight the night before, they will come on to our call that we have for the category 4, and then they will actually advocate for that space at that time. So we do, when we send everything out, we actually do include when we have West Haven openings available. And then families, we have the rapid rehousing. Again, those vouchers come from partnering agencies. We just do the referrals. And then the family flex funds, similar situation. Rapid rehousing could be a program depending on the client situation that could potentially help them for 12 to 24 months. Family flex is more short term. So you're looking at more like somebody who might need that first month's rent and security deposit, or maybe just a couple months of assistance and maybe just a little bit of case management. So it's a very scaled down version of the rapid rehousing program. And then veterans, we have housing vouchers also for them when we run our staffing, and those also come from partnering agencies. And then they do also have some of those PSH options as well. All right, so that is coordinated entry. Oh, looks like I got an extra at there in my email. This is my email minus one of the at signs. But if you have any questions, you can always reach out to me, drop it in the chat, or you can ask at the end, but I will pass everything off to Bob now.
Okay, I'm going to share my screen here just in a moment, so I'm sure I've got the right one up here. Okay. Okay, are you able to see my screen?
Yes, we are.
Great.
Yes.
Thank you. So I'm going to just briefly talk about a few things. We'll be sharing the slide deck here so you can read some of this on your own. Just a little bit of background about Impact. We've been around for more than 60 years. We've been operating hotlines really going back to 1969, 70. Some of you might remember a hotline called the Underground Switchboard, which goes back many, many years. And uh, that was a hotline that was developed based on, or was became a thing because of all the changes that were going on in the community back in the late 60s, early 70s. That the Underground Switchboard was all volunteer run and existed up until about 1996, 97, and the name changed a couple of times. It was Helpline for a period of time, and then it became the Community Information Line. So Impact has been operating that hotline and many other hotlines for many years. Impact 211, just a little bit of background about 211 in general. 211 has been available in the United States since 1997. Atlanta, Georgia was the first place where 211 became available. Our history was, in terms of how 211 became a thing in Milwaukee County, is that we were operating all these hotlines back in the mid to late 90s, and it wasn't making any sense. And us and many community stakeholders and funders went about the process of discussing the option of creating one centralized hotline. And we also became then aware of what was going on in Atlanta and a few other communities in the US that were also developing 211 systems. So we began using the 211 phone digits in 2002. There were a lot of regulations that had to be put in place both on the federal and the state level to make those dialing digits available. So we began our service in June of 2002, and all of these separate hotlines all kind of became centralized just with 211. 211 is available throughout the United States. 98% of the US population has 211 available to them. There's a few holdover counties where 211 is not available. Illinois and Chicago was one of the last big holdouts. They finally got 211 in their area just within the last 3 years, but that was one area of the country that really did not have the availability of 211. In terms of capacity, we responded to 71 of the state's total calls last year. 211, I should mention, is available throughout the state of Wisconsin. Anywhere in Wisconsin, if you dial 211, the phone will be answered. Impact is one of two 24/7 providers. There is another 24/7 provider based in the La Crosse area. And then other parts of the state are operated by smaller organizations. For instance, there's a 211 provider based in Wisconsin Rapids, and they have just 2 staff members. So overnights and weekends, those smaller 211s, with a couple of exceptions, roll all of their calls over to us. So we end up handling about 76% of the state population during those after business hours. Last year, we took about 238,000 requests for assistance. I'll get more into some data in a little bit. The next item you see there, in July, we surpassed our 3 millionth contact, and actually we surpassed 4 million contacts within the last 12 months. So we've been always very busy, as you can imagine, and like I said, we're always available and always able to take calls and contacts from at any time. We use a system that's called VisionLink. That's the database platform that we use to document the calls that we're taking. It also is used to hold the information about all the resources available in the community. So that's the base that we use when we're doing all of our work within within 211. We were one of the first 211 providers in the US to make ourselves available via text messaging. So folks just need to text their zip code to 898-211, and then that text message comes to us, and then we're able to interact with that individual via text messaging. This is one really good thing to keep in mind for folks that might have concerns about the amount of talk time minutes they have on their cell phone plans. Many people that are receiving some of those basic cell phone plans have very limited talk time minutes available to them, but usually folks have greater availability to use to text back and forth. So that's a good option for people that are concerned about burning up their talk time minutes. It's also a good option for people that might be in a dangerous situation. And we have talked to individuals that are in a domestic violence situation and the perpetrator is in another room, and that person doesn't want to get on the phone and start talking to people because they might be overheard, but they can communicate with us via text messaging, and we can help that person become safe or get them resources or whatever it might be. It's also a good option for folks that are in a public place and they don't want other people to hear their conversation. So, you know, as you're talking to folks and promoting 211 as a place to call, that's always something good to mention to people, that we can be reached via text messaging. We also have an automatic text relay system set up for finding a food pantry in Milwaukee County. And the same thing, you could text MKE food to 898-211, and then a series of questions would be asked about what day of the week the person would need food, what zip code they live in, and a few other things. And then what comes back to them is a list of available food pantries that the person can access. So this was something that was totally unique. We were the first 211 in the US to develop a system like this, and it's been duplicated in other ways by other 211s in the US. So let's see, resource database. So a couple of things, and I'm going to spend some time showing you our online resource directory. But last year we had close to 67,000 uses of our online resource directory. Impact maintains information on over 1,600 agencies in southeastern Wisconsin. We cover 9 counties in southeastern Wisconsin. So we maintain information on nearly 1,700 of those organizations, and that includes about 5,100 different programs and services in over 2,700 different locations or places where services are delivered. We also have access to all the information maintained by the other 211 providers in the state. So a person here in Milwaukee County may be calling with a concern about a family member living up in Ashland County. We can easily go into our database and look up information on service providers in Ashland County. And vice versa, somebody living in another part of the state may be calling on behalf of somebody living in Milwaukee County. And that 211 system, let's say it's in Wausau, that person in Wausau can also look up information about service providers here in Milwaukee. So we try to make sure that everybody in the state that are taking these 211 calls can take any call from any part of the state at any time. Usually this often happens that some situations might be more complicated, and then we have the ability to go ahead and just transfer that person to the 211 in, let's say, Ashland, that's covering Ashland County. In terms of the resource database, we have an inclusion policy, so we don't put just everything and anything in our database. We want to make sure that the resources that we have in the database are free, are available on a sliding fee scale, or they take one of the publicly available health insurance plans. So what we don't do is maintain information on every single mental health provider, for instance. So there might be mental health clinics, and there are many of them, but they don't work on a sliding fee scale. They don't accept Medicaid. And for those reasons, we don't keep that information. Usually if somebody calls us and they say, for instance, that they need mental health treatment, we sometimes ask them first if they have insurance. And from there, then we often direct them to check their insurance policy to see what providers out there might be available to them. So we try to work with in whatever set of resources people have to find help for them. We update everything at least annually, and many records are updated more frequently. Those would be things like food pantries, seasonal programs. There's always a lot of changes taking place at all times. We also check in with those organizations where we're providing a lot of referrals just to make sure that we're always current and up to date. This is our staffing makeup. We have about 30 full-time equivalent individuals. So we have close to probably a little over 40 staff altogether working in the 2-on-1 program. We have 8 bilingual Spanish-speaking staff. Those individuals are generally available from as early as 6 or 7 a.m. in the morning up until the late evenings during the week. And then those staff rotate throughout the weekends as well. We also have other languages available through a translation service too. So that's something also to keep in mind. We are able to check, work with other languages besides English and Spanish. So I'm going to get into some data just to kind of show you a little bit about the makeup of the people that are calling us. Here you can see the racial and ethnicity makeup for Milwaukee County and the city of Milwaukee, and looking at our 2-on-1 clients. So what you see here in this these first and second columns are the race and ethnicity makeup of Milwaukee County. So for instance, the population, 48% of the people living in Milwaukee County identify themselves as white. 27% identify themselves as being Black, African American. In the city of Milwaukee, it's a little bit different, where we have close to 39% of the population is Black, African American, about 21% Hispanic and Latino, and so on. But when we look at the people that are calling us, you can see that nearly 70% of the people calling us identify as Black or African American. So and when I show you some zip codes in a minute, you'll kind of understand why that is. And we know, for instance, that there are parts of the city of Milwaukee, especially that are in these low and medium low economic, socioeconomic status. I'm going to just work backwards a little bit here, and then I'll get more into showing you some data about zip codes and where people are calling from and what they're calling about. This is the makeup of the people in terms of the languages that they speak. We're concerned because we know that there are more Spanish-speaking individuals out there that need help, but they're not necessarily calling us. And so we are always really stressing, to folks that, if regardless of what language you speak, definitely call us, get in touch with us. I think right now with everything going on at the federal level, there are a lot of people that are very concerned about their status. For people that are Hispanic and Latino are here perhaps from other countries. And one of the things that some people have mentioned to us is that people are afraid to call 2-on-1 because they think we're a government program. But we're not, and we're anonymous and confidential, and people can call us and not have any fear that we're going to be telling whoever that this person called us. We really are here to help people get the resources that they need. So that might be one thing that we always try to mention to other communities, is that we're not a government program. Everything is confidential. People can remain anonymous. They don't have to give us their name if they don't want to, and everything else. So people should feel confident talking to us about sensitive issues, whatever that might be. These are the communities where people are calling from, and not surprisingly, most people are calling from the city of Milwaukee, but we see substantial numbers of people calling from some of our neighboring suburbs like West Dallas, Oak Creek, and Cudahy in particular. And it kind of follows the population for the most part. Cudahy has, if you're familiar, has a pretty high rate of lower income households in that particular community. So that tends to follow that many people, more people calls from Cudahy than some of the other communities that may not necessarily have lower incomes. So I lived in Cudahy for a while, so I kind of knew firsthand what was going on in that particular area of Cudahy and St. Francis. So I know very clearly that, you know, there are people that are struggling in that part of our county. So when we look at zip codes, these are the top zip codes of people that are calling us based on the percentage of households that are contacting us. And so when we do this data, we always divide the number of clients or the number of calls into the number of households. Because you can see here, the number of households in the zip codes varies quite a bit. You know, there are 19,000 households in 53209 and less than 3,400 in 53205. It would make sense that there are more calls from 53209 than 205. But if we just ranked by the number of calls, 53205 would rank really low, and we wouldn't be able to really see the number of households that are really in need of help. So that's why we kind of do it this way. And over here, you can see again that most people that are calling us are from zip codes that are in that low and medium low socioeconomic status. And this is in terms of Milwaukee County, this is what people are calling about. So this is from last year. So you can see shelter and housing together are make up a majority of the people that are calling us. I'll explain a little bit more about why mental health is highly ranked. But you also see here a lot of other basic needs services are requested when people are contacting us: food, clothing, energy assistance, those sorts of things. This is a slightly different look at that, where you can really see nearly half of the people calling us are calling about housing and shelter needs. And then the whole broader category of health, mental health, and substance abuse disorder concerns is kind of the second big category. And when you look at other basic needs and food together, what that makes up, you know, about 38% of the people calling us. So that's pretty significant. And I'll share a little bit more in a minute about what we're seeing in terms of people in need of basic needs services from the pre-pandemic years, during the pandemic, and now in this post-pandemic era. In terms of mental health, I wanted to mention that since 2018, Impact 211 has been answering the mental health crisis calls for Milwaukee County Behavioral Health. So all those calls dialed to their crisis line number come to us first. And what we do there is we do an assessment for people that are calling us. Many of those individuals just need to talk with somebody for a short period of time. And usually we can handle it. It's really what we call supportive listening. Many people are chronically mentally ill. They may not have very healthy relationships or connections in the community. And what those individuals do is they might call us every day, usually at about the same time, just to say hi and have a pleasant conversation with somebody or tell us what's going on with their day. And that's perfectly okay. I mean, if that's what helps them get through the day by having a short, friendly conversation with somebody, that's great. You know, if that keeps them stabilized and also gives them a place where they can reach out in case things aren't going well. They might not have a good day, and then we can have a more in-depth conversation with them, or we can transfer them over to a mental health professional with Milwaukee County Behavioral Health. The other thing we're monitoring too are people who are in an extreme mental health crisis. That's above our pay grade. We are not mental health counselors, and what we would do in that situation is do a direct transfer over to a mental health professional and let them take over the call. And then, of course, there are the serious situations where people may be suicidal. We can't understand what they're communicating with us. And in those situations, we work with emergency responders. That would mean, you know, the police, fire department, whoever it might be, to immediately go to where that person is so they can get the help they need. So what I showed you back here, these are major categories or larger buckets of needs. And what you see here are more specific categories. So not surprisingly, housing and coordinated and the housing related coordinated entry need has been the largest call category for us for a number of years, largely because of our role in the community as acting as that central access point for people who are in a housing crisis or facing uh, or are homeless. Food pantries is then the second largest category. And you can see here again, it's fairly high in basic needs type services as you kind of go down the list here, with housing related things being very high. Rent payment assistance is, I'm guessing, a big category of the types of needs that you're sometimes facing too. That's a big category for us. Kind of further down, these didn't quite make it to the top of the list, but these are some of the other sorts of things that people contacted about: domestic violence shelters, child abuse and neglect reporting. Human trafficking is way far down the list, but this is a really important thing for you to know that these calls do come to us. They're very serious and very critical that we try to help those individuals that are mentioning that they might be the victim of human trafficking. And I mentioned here too, harm reduction. You're probably familiar with naloxone or the opiate antidote that is available in many places in the community, but that includes fentanyl test strips and needle exchange programs. So again, not a whole lot of calls, but definitely something that we encounter with folks that are talking to us. So I'm going to quickly go through some slides here to kind of illustrate what's happened over time. So I'm going to really look at what happened, what was going on pre-pandemic, during the pandemic, and then in these post-pandemic years. So these are some of those categories that you saw earlier. And you can see some consistencies here. You know, housing and shelter tend, going back to even 2011, tended to be the largest category for every year. Food was very high for us in these pre-pandemic years, and then it kind of dropped quite significantly during the midst of during the peak periods of the pandemic. You know, really beginning in 2002. I'm sorry, 2021 up through 2023. And in an upcoming slide, you're going to see how things are changing with that. But this kind of gives you an idea of what we've been observing over the years. And there might be some reasons why things have changed the way they have. So this is just focusing on basic needs requests and really focusing on food and clothing requests. So this green part of the graph here, these are requests for food. So you can see it was fairly high in 2011, really peaked in 2016, started to drop in 2019. There was a big push in the early days of the pandemic for people that were all of a sudden out of work and really needed emergency food. But then that emergency with a food share benefit was put into place kind of in late 2020. And a lot of people all of a sudden had the means to purchase food with their food share. And there are many households and individuals that all of a sudden qualified for food share. So we really saw a huge drop beginning in 2021 in people calling us for emergency food because they had access to food. They didn't need to call us. They weren't running into that situation. But you can see here the ending of the food share benefit started in 2022. And then in 2023, we started to see an increase in calls for food. And then going into 2024, again, it's trending upward again. Similarly with clothing and other basic needs things, a little bit of a drop here during the peak of the pandemic. A lot of people had additional financial assistance and financial aid made available to many of us through those checks we were getting from the federal government. People were able to purchase clothing on their own. They didn't have to go for looking for free clothing. But again, as those benefit as those benefit programs ended, we're starting to see this upward trend again in calls to us for basic needs services. And this is just looking real specifically just at foods. So it's really clear. You can see here the drop took place during those years, and now we're seeing an upward trend taking place. beginning with really in 2022, but really accelerating in 2024. Similarly, with shelter and homeless, there was a little bit of a drop again during that period during the pandemic. There was, if you remember, the rent payment assistance program that was available to many households, really kind of alleviated some of the strain people were feeling without with paying their rent and housing costs. They didn't need to call us and looking for that kind of help. But those programs ended, and now we're seeing this upward trend taking place again going into last year. And this is housing, and this is non-shelter requests. So again, we had a lot of calls in 2021. That was before that rent payment assistance program really kicked in. And people are calling us because it was available. People called us and wanted to know where they could get that kind of help. So we really saw a huge increase there, kind of flattened out a little bit. But overall, we're kind of watching this really carefully because non-shelter housing requests are something to be concerned about, because usually if somebody is calling because they can't pay their rent or they have an eviction related issue going on, that might lead to them possibly facing a housing crisis. And they may end up then calling us because they're all of a sudden they're homeless and they need shelter. So that's something that we're always keeping a close eye on. And this is why it's so important for us to make sure that the information that we have about those service providers is accurate and up to date at all times. So I'm going to jump into how you can use our online resource directory. So this is the website address where that you can go to access the online resource directory. And if you can't remember that, if you just Google 211 Wisconsin, the link will come up in your search about how you can get to our online directory. And this is what it looks like when you get there. And there's different ways that you can search for information. This is kind of the general page that people can use, but it's probably not the best way to really look for information because we have these categories broken out, and I'll show you a live demonstration in a minute. But this is where you can pick, and you know, this slide shows just children and youth, and it shows all the different types of categories that are related to children and youth. So you can see all these really specific search terms that are related to that. And it follows with the other categories as well, where you can really drill down really closely to really identify the type of need that you might be in need of, or the person that you're trying to help is in need of. So I'm going to stop sharing and I'm going to just show you kind of live what that might look like. Okay. Okay. Try this again, sorry. Okay, are you able to see this online directory here? I'm scrolling up and down on. You are?
Yes,
okay.
It looks like
okay.
You can. Yeah.
Good. So this is kind of live. This is the online directory. Definitely take some time to look at this front page here. But I really wanted to show you by how you can search by need. And this is where you can really drill down. And I showed you this on a slide a minute ago. But this is where you can like pick out, for instance, all the different categories for clothing and household goods. This is domestic violence, sexual assault. These are the different types of food search terms that are available. Housing and shelter, all the different search terms that you could use there, and so on. And it really gets down to some specific categories for mental health, substance use disorder, and other sorts of things.
Bob, could you just show us one more time, like where you got to that needs, that very first?
Sure.
Yeah.
If you go up here to find services, so I'll kind of go back here to the home page.
Mm-hmm.
And if you go to find services,
And then search by need or,
you can do categories. I did search by need. That's where I came up with all these subcategories, is search by need
all right, thank you.
right there. I would recommend you use it in that way. This is another way to do that. It breaks things out a little bit differently. We really focus on these major categories a little bit differently for instance, mental health, and it drills down into a slightly different set of search terms there. So I'll go back here to this, and I'll just pick out a food. I'll look at formula and baby food, and then put in a Milwaukee County zip code, and then do search. And first of all, you'll see a map here, but then each of the different service providers centered around that zip code 53205 then start to show up. So you'll first see those providers that are in 53205, and then here you see some of the neighboring zip codes that offer formula and baby food. So all those things are kind of sorted by proximity of where you are searching from. If you were to go just to this, you could click on formula baby food. And here's where you see all the details, their hours of operation, their eligibility requirements, the intake process, any documents that might be required. All those sorts of details are all here on this page. I'm going to go back here to this previous screen. And the other cool thing you can do here is you can email or text that link to yourself to the person you're working with. So then they can get that information sent directly to their cell phone. Then you don't have to make sure, write all this information down for them. They can, you or the person can just have it on their cell phone or in an email. And that really helps save people from, transposing numbers or not having a pen or a piece of paper available, whatever it is. We use that a lot for the folks that are calling us, and people really love that. We can, it always takes time to read out all that information, but if we text it to them and we're on the phone with them and we can say, hey, did you get the text with the information? They can say yes, then we don't have to worry about people not having a pen, or people sometimes think they have a really great memory and they don't always remember things like they think they can. I would really encourage you to take some time to really spend exploring the online database. On the slide deck, my email address will be there, and definitely get in touch with me if you want more information or need some help with navigating the site. If you'd like me to come directly to one of your parishes, or I'd be more than happy to do a demonstration there for people in your parish, whatever it is, we're more than happy to come out directly to you and talk to you about how to use the online database or anything else about 2-on-1.